Hey everyone, welcome back to Medical English Pro, your channel for smart, clinical, and confident English. If you're preparing for OET medicine, PLAB, or IELTS for healthcare, this episode is your ultimate vocabulary booster. We're going beyond memorizing words. We'll learn how to use medical vocabulary in exam tasks, speaking role plays, writing case notes, listening and reading tasks. And by the end, you'll know 50 high-value words and collocations that every examiner loves to hear. Section 1. Why vocabulary matters in medical English exams. In medical English exams, vocabulary equals marks. Examiners assess your ability to use precise medical language, select natural collocations, and avoid generic words like thing, problem, or good. So instead of saying, he has a heart problem, say, he presents with cardiac symptoms suggestive of ischemia. See the difference? That's vocabulary power. Section 2. 10 golden collocations for every exam task. Let's start with 10 collocations you can drop into any OET or PLAB speaking or writing task. Each of these can earn marks for lexical resource and professional register, two scoring categories in OET and IELTS speaking. Basic, he has pain. Advanced, he presents with pain. This is one of the most common changes that instantly sounds professional. In clinical English, we don't say has pain, we say presents with pain. It means the patient came to the clinic because of that symptom. 2. Basic, for 2 days. Advanced, with a 2-day history of. This one is perfect for your writing subtest or case notes. Instead of saying, he has had fever for 2 days, say, he presents with a 2-day history of fever. Concise, clinical, and exactly how doctors report symptoms. 3. Basic, it got worse. Advanced, the symptoms have deteriorated. Got worse sounds casual. In medical English, we talk about deterioration. So instead of saying, his condition got worse, you say, his condition has deteriorated since admission. 4. Basic, I checked his heart. Advanced, cardiac examination revealed. This one sounds like it belongs in a professional report. Instead of saying, I checked his heart and it was fine, say, cardiac examination revealed normal heart sounds. Much clearer, more formal, and exam-friendly. 5. Basic, I made a test. Advanced, I ordered investigations or I requested tests. Never say made a test. That's a classic learner mistake. You order or request investigations. So say, I ordered blood tests to rule out infection. Perfect. 6. Basic, I think. Advanced, it is likely that, or our impression is that. In professional contexts, I think is too personal and informal. Examiners love expressions like, it is likely that this is a viral infection, or our impression is that the patient has pneumonia. This shows reasoning, not just opinion. 7. Basic, I will give medicine. Advanced, I will initiate treatment, or I will start therapy. In OET writing, you'll often need to describe what treatment was started. So instead of, I gave antibiotics, say, I initiated antibiotic therapy. Formal, precise, and medically accurate. 8. Basic, don't worry. Advanced, it's a common, manageable condition, and we'll monitor you closely. In the speaking exam, reassurance matters, but the language must sound professional. Instead of a casual, don't worry, say, it's a common and manageable condition, and we'll monitor you closely. It calms the patient and earns points for empathy and tone. 9. Basic, you should. Advanced, I'd recommend that you. Direct commands can sound rude or too strong. In medical English, use polite, soft recommendations. I'd recommend that you avoid strenuous activity for a few days. It shows both professionalism and care. 10. Basic, in short. Advanced, To summarize, the key issues are: this phrase is perfect for ending a case summary or handover. Instead of, "In short, he's fine," say, "To summarize, the key issues are dehydration and low blood pressure." It's formal, structured, and clear, exactly what examiners want. Section 4. Vocabulary for common exam topics. Now let's boost your vocabulary for the top 5 exam themes, because they repeat constantly. Cardiovascular, chest discomfort, to substernal pain or tightness. High blood pressure, to hypertension or elevated BP. Heart attack, to myocardial infarction. Example OET speaking. Given your risk factors, these symptoms could indicate angina. I'd like to arrange an ECG to rule out myocardial infarction. 2. Respiratory. Shortness of breath to dyspnea, coughing up phlegm to productive cough, lung infection to pneumonia or lower respiratory tract infection. Example writing. The patient was admitted with a 3-day history of productive cough and dyspnea. 3. Gastrointestinal. Stomach pain to abdominal discomfort, vomiting to emesis, diarrhea to loose stools. Speaking task, you mentioned vomiting. Have you noticed any blood or change in stool color? 4. Neurological. Fainting to syncope, numbness to paresthesia, stroke to cerebrovascular accident or CVA. Writing task, on examination, there was right-sided weakness suggestive of an acute cerebrovascular event. 5. General communication. Check to assess, evaluate, review, give medicine to prescribe, administer, initiate therapy, get better to respond to treatment or recover. Use these instead of plain verbs. They sound natural, precise, and professional. Section 4. Mini Practice Challenge. Let's test your fluency. I'll describe a basic sentence. You make it sound professional. Ready? 1. The man has a stomach problem. 2. He got better after the medicine. 3. She can't breathe well. How many of these did you upgrade? Find answers in the comment below and write your score. You've just built a vocabulary toolkit powerful enough for any medical English exam, OET, PLAB, IELTS, or beyond. Remember, use collocations, not single words. Apply them naturally in speaking and writing. Recognize them in reading and listening. If this helped, hit like, share it with your study group, and subscribe. Follow for more Medical English Pro.